Hi, my name is Dr. Alexa Parker with Synergy Integrated Health, and today what I'd like to do is share with you just a typical example of the type of cases that we work with and kind of go through some of the steps of treatment that we did with this patient and kind of give you, an overall idea of how we came to treat this person and get them really functioning 100% better. So the case that I want to talk about is a 46-year-old female that I have worked with. She came in really complaining of severe fatigue for about 20 years. The fatigue was constant, in the morning, afternoon, and then at night she'd have some difficulty sleeping. But even with, 6 to 8 hours of good sleep, she still was chronically fatigued. She also suffered from anxiety, depression, brain fog. The memory was really difficult in terms of at work. She was starting to see difficulty with remembering things. She had severe abdominal pain, reflux, GI distress pretty much on a daily basis. When she came to me, she had already been diagnosed with a thyroid problem. It's called Hashimoto's thyroiditis. And basically what it is an autoimmune attack against the thyroid. And she had also been on thyroid medication, however, still really suffering with a lot of symptoms. She also mentioned that she had a history of Epstein-Barr virus when she was in college. Other than that, there were really no other major triggers, to her problem. When we did some thorough blood work, we were able to analyze that blood work, and we did a very thorough panel. And the blood work kind of really pointed towards her having a lot of adrenal problems, adrenal stress. Also, some issues with digestion in terms of the GI tract and the stomach. Along with that, we did see some factors that pointed towards anemia. And her TSH was about 20 plus, so above that. Normally, the TSH should be between about 1.8 and 3.0, so that was very hypothyroid. Along with that, she had TPO antibodies or thyroid antibodies of 75. Normally, we want them less than 20, so we know that definitely she had a clear autoimmune attack against the thyroid. She also had very low T4, so even with the medication, she was not getting enough T4. Her T4 was about 3.2. Normally, we want that to be 6 or above. So with that blood work, we knew that there were definitely some major players, with the anemia, the adrenals, the gut system, and all of those, particularly the gut system and the adrenals, really play a large part, with thyroid, with hypothyroidism and autoimmune thyroid. When we do a physical exam, it's called comparative nutritional testing, and what we do is we actually examine someone and look for the underlying causes. We use something like applied kinesiology testing, but it's much deeper. And we can actually find, if there's infections, which a lot of times, that's one thing I find all the time, is that there's underlying bacterial infections, viral infections, parasitic infections. Also, I see a lot of chemicals, particularly glyphosate, a lot of xenobiotics or chemicals in our foods. A lot of times, people are eating really good, a lot of vegetables, or they're eating meat. In any case, even if they're organic, a lot of times they can get chemical residue on them, and that can really impact a person's, detoxification pathways, and also affect the thyroid significantly. So in her case, I did find actually strep bacteria. I found a chronic viral infection in the Epstein-Barr virus family. I also found candida, and all of these infections that I found, not only were they affecting the thyroid, they were actually affecting multiple areas in the body, particularly the brain, the muscles, the joints, causing a lot of pain. Also the adrenal glands. So, the adrenal glands you look at, a lot of times you'll go to a doctor and they'll give you, adrenal support or thyroid support. But unfortunately, most of the time we're looking at adrenals as a secondary cause. So for example, the infections are really what's driving those adrenals to be completely fatigued. So in her case, she had, strep infections, viral infections, largely affecting the thyroid and the adrenals. Also parasitic infections and candida. Along with that, we found chemical residue. So that, along with her having some detoxification pathway problems already, like MTHFR defects, she also had a lot of chemical residue really affecting that not only thyroid function but also liver function. So we found that during the exam, and we were able to also do some thorough testing with saliva, in which case we found high testosterone and high estrogen. So those issues can also affect, the ability to get enough thyroid hormone. So in her case, since she was autoimmune thyroid, we recommended that we do some thorough autoimmune-based or antibody-based testing to look at gluten sensitivity and cross-reactivities. In her case, she was definitely gluten sensitive, plus she had a lot of cross-reactivities to gluten. So once someone, has a large autoimmune response in the body, they tend to not only react to gluten, but they can also start to attack other foods that look like gluten, such as eggs, dairy, rice, potato. In her case, she had a lot of those problems. So basically, not only did we have to really clean up the diet and correct, the gut system and work on healing the gut, but we also had to really manage and correct all of these infections. So I would say over the course of 4 months, I worked with this patient weekly, and largely what we started working with at first was killing off the infections. So we started with the strep bacteria. When we tested, we found that the strep bacteria was in multiple locations in the body. And what we had to do was actually use specific supplementation to target that tissue so that we could pull the infection out of the body system, all of the areas. So rather than just give like antibiotics or antibacterial supplementation, we have to actually target the tissue that the infection spread to. So in doing that, it took us a couple weeks to really get the strep bacteria under control. Along with that, we use the Rife machine, which helps us also kill the infection, along with the PEMF. PEMF is something that helps build energy as well as detoxification. So as we're starting to kill that infection off, we're also able to help build some energy for the patient. Secondly, we worked on killing off that viral load. She had a chronic virus that was there for, again, probably approximately 20 years. Viruses are also something that are really going to impact thyroid function and obviously, make you extremely fatigued. So our next step was to work on the virus, which had spread globally. That took us approximately 2 to 4 weeks, I believe. We also worked on killing candida, and then eventually we got to detoxification. So as she started to feel better, we started killing off the infections, she started to function better, she was able to exercise more, she was able to think more clearly. She noticed that her work became a whole lot easier because she was able to, multitask and get things done like she had been before. She also noticed she was sleeping better, her anxiety came way down, her mood improved in terms of her interactions with her family, she was less moody and irritable. Her depression subsided. Along with that, she lost about 10 to 12 pounds just by, killing off infection, decreasing inflammation, and healing the gut system as well. She obviously also found that she was able to exercise, so she went back to running like 2 to 3 miles a day. So all of these things, improved over, gradually over a course of 4 months. But each week we would see, a gradual improvement with her. So, this is really why we practice. We love to practice and help people. There's nothing better than seeing a patient, change the habits in their life and, feel better and be able to really enjoy their life and enjoy their work, enjoy their family, get out there and have a good time in life and not have to worry about, this chronic condition. So thank you for listening, and I hope you were able to gain something from this today. And feel free to give our office a call if you're suffering from some of these problems. Our number is 813-254-5200. Thank you, and hope to see you in our office.